violent extremism, radicalization, and again here the retired police officers who are spread all over the place, because when we do recruitment, we actually recruit from all over the country. And when these officers retire, they go back to their localities. And they're there and they're trained and they can be able to be used in community policing and even the work that the reservists are doing. We are also advocating for the establishment of a National Police Research Center, where the retired police officers that have got immense knowledge, skill, and education can be used as researchers and consultants, and especially in the areas of bomb expertise, traffic management, which has been a very big problem in this country, investigation, aviation, including incident and accident investigations. As we speak now, there's a very high number of accidents in the recent past in aviation, and of course some of which could be related to security. Therefore, we need to actually think and come up with recommendations, and the data of which that comes from this can be used to be able to rate our trends and build confidence in policing and reforms in Kenya. Now, you also know that of late we've been having lots of police officers killing themselves, committing suicide, and you go to police stations and these people are so harsh. The language they use is very unbecoming, and you ask yourself why. We are advocating for what we call employee assistance program. This has been a strategy that has been used in South Africa, in Australia. You go to Egypt and other development countries. And what it does is that it provides for early identification of troubled officers and their families with personal or work-related behavioral concerns that affect their work performance. In short, what it does is provide short counseling, assessment, referral for specialized treatment, and a follow-up before being brought back into the service. It allows for constructive consultation and training of senior officers so that they are taught how to identify these fellows. Because what happens, even at the station level and even at division level, there's a rift between those junior officers and their bosses. So they will not be able to know what really happens with the officers in terms of runaway substance abuse, stress, depression, that have negatively impacted our junior officers psychologically, emotionally, in terms of well-being. This is known to, of course, like I said, prevent that being aggressive in the course of service delivery, prevent gender-based violence, homicide, other human rights related to offenses that have been in the service for this long. Infrastructure, of course, all the other departments, ministries, as they undertake their work, including roads, rural electrification, we are saying that they must not forget the need to put in place intervention or measures that would not encourage criminality. Monitoring and evaluation as part of research is something that is new, and we are saying that it should be put. If you don't monitor and you don't measure what you're doing, then you cannot be able to come up with an intervention. So it should be able to monitor key indicators and track progress, analyze trends over time, and develop an understanding of systematic challenges. And the data which is generated here can help identify a specific or particular aspect of police work that generate high numbers of complaints or experiences and challenges faced by staff, and try to ameliorate these. So before I give my chair to conclude, we have a few recommendations, one of which, of course, we are asking, given the fact that these officers have served for a very long time, given honorable service, It is also important that when they go back, they should be able to go back in some good housing. So affordable housing scheme for them is not something that we are over demanding. Revision of their pension, as of course the economy also changes, because you find that what they get home really would only encourage them to go and drink changa and not do anything that is important for them. Budgetary allocation for NAPOC, because NAPOC, as you've heard, has got chapters, and we are thinking of having 47. So you need to be able to operationalize its activities, and therefore it requires finances. Health policy, as we age, they say that when we are limping, it's not because we are sick, it's just because of age. And that is the time that we really require some health assistance. So health policy, alongside our serving officers, is very, very key. And last but not least, is a need to be able to acknowledge that these officers, they have knowledge, they have skill and experience, and some of them are still serving like you've heard. Why can't they be recognized, especially when there are appointments in key bodies or assignment in the government and sub-county governments? Thank you very much.
Thank you very much, Engineer Ochieng.